Simply put, the difference between a lateral ankle sprain and a high ankle sprain is the location of the ligament or ligaments that have been injured. The ankle joint is composed of three bones: the thick tibia on the medial side, inside part of the leg, the thinner fibula on the lateral side or outside part of the leg, and the talus. In a lateral ankle sprain, we've all had the experience of rolling the ankle where the plantar aspect of the foot, the sole of the foot, points inward toward the midline of the body. The three most commonly injured ligaments in this type of injury, in order of injury, is number one, the anterior talofibular ligament, which connects the talus, the ankle bone, to the fibula. Second most common is the calcaneofibular ligament, which connects the calcaneus, the heel bone, to the fibula. And least commonly is the posterior talofibular ligament, which connects the talus on the backside to the fibula. A high ankle sprain can occur when there is external rotation of the foot, meaning the toes are pointed away from the midline of the body, and dorsiflexion, they are pointed up from the mat or the ground. Very commonly when an opponent lands on the lateral aspect of the ankle, pushing the ankle inward. This external rotation, dorsiflexion, and inward pressure pushes the talus up into the space where the tibia and fibula are, causing the injury. The three most commonly injured ligaments in a high ankle sprain are the anterior tibiofibular ligament, which connects the tibia with the fibula on the anterior front part of the ankle, the posterior tibiofibular ligament, which connects the tibia with the fibula posterior side, meaning the back side, and this very thick ligament that runs from the ankle close to the knee, the interosseous membrane, otherwise known as the middle tibiofibular ligament. Symptoms of a lateral ankle sprain can include pain and swelling on the lateral outside part of the ankle, which can radiate into the foot. Symptoms of a high ankle sprain can include pain and swelling higher up, which can radiate into the foot and up into the knee joint. There are three grades of injuries. In a grade 1 injury, the ligament, which is composed of thick fibrous bands, is stretched beyond its normal capacity but not torn. In a grade 2 injury, there is a partial tear. Some of the fibers have been torn. And in a grade 3 injury, there's been a complete tear of the ligament. Recovery time for a lateral ankle sprain can range from 4 days to 3 months. A high ankle sprain can take 4 to 8 weeks up to 6 months. Initial management involves rest, ice, oftentimes a walking boot, crutches non-weight bearing, and anti-inflammatories.